What does it take to stop the spread of infectious diseases in a community? Today, we go inside Jamaica's Contact Investigation and Social Disease Intervention Specialist Training Program, a national effort to break the chain of transmission for HIV, syphilis, and other infectious diseases. Let's explore the journey of a contact investigator in Jamaica, from foundational training to real-world impact. We'll cover the program's structure, the essential skills and values, how field investigations work, the importance of confidentiality, and the difference these specialists make. What does it take to become a contact investigator in Jamaica? In this chapter, we reveal the structure, goals, and unique features of the national training program that prepares professionals to fight the spread of infectious diseases. Here's how the Contact Investigation Training Program is structured to build both knowledge and real-world skills. The training program lasts 12 months and uses a blended approach, combining workshops, webinars, self-study modules, and supervised field preceptorship. This is a partnership between the Ministry of Health and Wellness and the University of Technology Jamaica, ensuring both academic rigor and public health relevance. The curriculum is competency-based, emphasizing not just knowledge, but also practical skills and professional values. The program's goals are ambitious: to break the chain of transmission and protect public health through skilled, ethical intervention. A key goal is to interrupt disease transmission by identifying, interviewing, and supporting individuals with communicable diseases. Another objective is to confidentially notify and refer exposed contacts for testing and treatment. The program trains specialists to implement evidence-based public health interventions that prevent future infections. The program uses a mix of learning methods to ensure trainees are ready for the realities of public health work. In-person workshops provide foundational knowledge and help clarify professional values. Weekly webinars cover infectious diseases, STI syndromes, HIV prevention, and contact investigation practice. Trainees engage in self-directed learning through readings, online modules, and case studies. The heart of the program is a 10 to 12-month field preceptorship, where trainees apply their skills under the guidance of experienced mentors. What makes a contact investigator truly effective? In this chapter, we explore the core competencies and professional values that define the role. The knowledge base for contact investigators is broad, covering science, clinical care, and ethics. Contact investigators must understand epidemiology and surveillance to identify and respond to disease outbreaks. They need clinical knowledge of STI and HIV syndromes, transmission, and public health management. A strong grasp of legal and ethical frameworks, especially confidentiality and patient rights, is essential. These are the practical skills that enable contact investigators to break the chain of transmission. The directed interview approach is a structured, confidential method for eliciting sensitive information from clients. Contact investigators must systematically identify and notify partners who may have been exposed to infection. Field investigation skills are crucial for locating and supporting exposed contacts in the community. Professional values are as important as technical skills in this field. Confidentiality and ethical practice are non-negotiable values for every contact investigator. Cultural competence means providing non-judgmental, person-centered care to all clients. Effective teamwork and collaboration with other health professionals are essential for success. How does a contact investigator turn training into action? This chapter follows the journey from case interview to field investigation and public health impact. Let's trace the chain of events in a typical contact investigation, from the first case report to the final follow-up. The process begins with the identification of a new case, someone diagnosed with a priority communicable disease. A confidential interview is conducted using the directed interview approach to elicit information about partners and contacts. The investigator systematically lists and locates all exposed contacts. Partners are notified confidentially and referred for testing and treatment. Field investigation may involve community visits to locate contacts who are hard to reach. Throughout, the investigator maintains accurate records and submits required reports. Finally, outcomes are reviewed and the process is monitored for quality improvement. Contact investigators rely on standardized forms and digital tools to ensure every case is managed and reported properly. The interview record is used to capture all relevant case details and contacts. The field record guides the field investigation and follow-up of contacts. Monthly summary statistics reports track the performance of the contact investigation program at parish, regional, and national levels. Certain conditions are always prioritized to protect the most vulnerable and prevent further spread. HIV/AIDS and syphilis cases are always top priority for provider-led investigation. Pregnant women with reactive syphilis tests are prioritized to prevent congenital infections. Cases of ophthalmia neonatorum and STIs in children receive special attention and rapid response. Why is confidentiality so critical in contact investigation? In this chapter, we examine the ethical principles and legal frameworks that underpin the work of every contact investigator. Confidentiality is protected through private interviews, secure records, and careful communication. Interviews must always be conducted in private to protect client information. All records, paper and electronic, must be stored securely, with access limited to authorized personnel. When conducting field visits, investigators use neutral language to avoid revealing sensitive information. Ethical and legal frameworks provide the foundation, but professionalism and judgment are the best guarantee of privacy. Jamaica's Data Protection Act sets legal requirements for handling patient data. The Secrecy Act governs all healthcare workers, including contact investigators. Ultimately, the professionalism and judgment of the contact investigator are the best guarantee of privacy and confidentiality. Screening for intimate partner violence is a critical step to ensure that partner notification does not put clients at risk. Before notifying partners, investigators screen for risk of intimate partner violence to protect client safety. If risk is identified, notification is deferred until safety measures are in place. How do we know if the contact investigation program is making a difference? In this final chapter, we look at the impact, performance standards, and the future of disease intervention in Jamaica. Strict performance standards ensure that the program responds quickly and effectively to every case. The program aims to interview at least 95% of new cases within 6 weeks. At least 90% of locatable contacts should be tested within 6 weeks. Class 1 notifiable illnesses like HIV and congenital syphilis must be reported within 24 hours. Jamaica's contact investigation program is not only saving lives at home, but also setting a standard for the region. In 2024, Jamaica achieved WHO certification for eliminating mother-to-child transmission of HIV and syphilis, a major public health milestone. The program supports Jamaica's progress toward the UNAIDS 959595 targets for HIV diagnosis, treatment, and viral suppression. Jamaica's program serves as a model for other Caribbean states seeking to strengthen their disease intervention workforce. Every contact traced, every partner notified, every case managed. These are the moments that break the chain of transmission and protect communities. By investing in skilled, ethical contact investigators, Jamaica is building a healthier future for all. The fight against infectious diseases is ongoing, but with every new specialist trained, the chain of transmission grows weaker.